Hello and welcome to Inside Health with Dr. Younas. I'm Dr. Younas, and in this video we're talking about something incredibly important: how to prevent a heart attack. These are simple, practical tips that anyone can follow. So let's get started. Before we begin, please remember this video is for educational purposes only. It is not a substitute for medical advice from your doctor. Always talk to your healthcare provider about your health issues. A heart attack happens when blood flow to the heart muscle is blocked, usually by a clot or cholesterol buildup. Without enough blood, part of your heart muscle can be damaged or even die. But here's the good news: most heart attacks are preventable, and we will go over how. Let's start with diet. What you eat has a direct impact on your heart. Eat lots of colorful fruits and vegetables. Choose whole grains like oats and brown rice. Use healthy fats such as olive oil, nuts, and avocado. Pick lean proteins: chicken, fish, lentils, and beans. And avoid processed foods, fried items, sugary drinks, and excess salt, because these can damage your arteries over time. Even healthy food can be too much if we overeat, so do not overeat. Try using smaller plates and drink water before meals. Avoid eating in front of the TV or scrolling your phone. It helps you notice when you are full. And next up is exercise. The heart is a muscle and it loves movement. Aim for 30 minutes a day, 5 days a week. Walk briskly, dance, cycle, swim, whatever you enjoy. Even small activities like taking the stairs or doing housework count. The key is to move more and sit less. Now let's talk about the stress. Stress is a silent threat to your heart. I repeat, stress is a silent threat to your heart. And chronic stress raises your blood pressure. It weakens your arteries. Try deep breathing, mindfulness, or prayer, and go for a walk in nature. Talk to someone you trust, and reduce how much time you spend watching upsetting news or scrolling endlessly. There are also a few habits that do real harm to your heart. First, quit smoking. It's one of the best things you can do for your health. Second, try to quit alcohol. Third, do not sit for too long. Try to get up and stretch every hour. And finally, keep a healthy weight. Even losing a few pounds can help lower your blood pressure and cholesterol. It is important to know your numbers. Get regular checkups and track these. Blood pressure, aim for under 120/80 millimeters of mercury. Cholesterol, keep your bad cholesterol low and your good cholesterol high. What is bad cholesterol? LDL. What is good cholesterol? It is HDL. HDL means high density lipoproteins. LDL is low density lipoproteins. So keep LDL low and keep HDL high. Then blood sugar, especially if diabetes runs in your family. Take care of your waist size. Belly fat is a major risk factor. If you have a family history of heart disease, be extra proactive. You don't need a big overhaul to protect your heart. Start small. Add a salad to your lunch. Take a 10-minute walk every day, every dinner. Choose a fruit instead of a donut. Breathe deeply when you are stressed. And talk to your doctor about your health issues and health goals. So let's recap. Eat healthy, move more, stress less, know your numbers, avoid tobacco and alcohol. These are small everyday actions, but then they can make a huge difference. So protect your heart, love your life. If this video helped you, please give it a like, subscribe to the channel, and share it with someone who might benefit. Let's all stay healthy and informed together. Thank you for watching Inside Health with Dr. Younas. Until next time, take care of your heart and it will take care of you.